Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. We're talking to Dr. David Tiber with Pediatric Critical Care about dry drowning. Dr. Tiber, what is delayed death from drowning?
So delayed death from drowning is when a person has a drowning incident. Drowning does not necessarily mean that a patient dies while they're underwater. A drowning event is when a patient goes underwater and has difficulty breathing. They may come out of the water and look just fine. They may initially be sick, or they may be sick later on. It can happen up to the first 24 hours after they're pulled from the water. What really happens is two different types of things. One can be where the water hits the vocal cords and causes the vocal cords to spasm shut, and the patient can't breathe. This usually happens immediately after coming out of the water or while they're underwater. The second way that this can happen is that water gets past the vocal cords into the lungs. And when this happens, it disrupts the way the lungs work naturally. And the patient may look fine initially, but as damage occurs over the next 24 hours, they can then fall ill and die.
Why is dry drowning a misnomer for this type of drowning?
So dry drowning is a misnomer because all drowning occurs underwater, or at least under some form of liquid. So therefore, all drowning is wet. You may not see water coming out of a person's mouth, and that may be why the term dry drowning came into favor, but it's actually not a preferred term.
How common is death from delayed drowning?
It's actually very rare. It accounts for about 1 to 2% of all drowning incidents.
Can you walk us through what happens when someone experiences delayed drowning?
What happens is the patient goes underwater, and the big thing to understand about drowning in general is that it doesn't occur for the most part like it does on TV. There's no thrashing, there's no screaming, there's no yelling, there's no water being thrown everywhere. Most times a patient sinks under the water silently, and there's really no surface evidence that the patient is actually drowning. What happens is then water gets into the lungs, and as I said, it disrupts the way the lungs work. The patient can come out coughing, or they may come out of the water looking just fine. And as the lung damage accumulates over the next 24 hours, they can then fall ill. And this can occur in a number of different ways. Unfortunately, the signs are not very clear.
Is there anything parents or children can do to avoid delayed drowning?
Biggest thing that parents can do is not to prevent the delayed drowning, but to prevent the drowning incident from happening in the beginning. What's most important is water safety, so fences need to be up around pools. Children need to be supervised at all times when they're in a pool. The best thing for a parent to do is actually be in the water with them so that they're actually paying attention to the child and not getting distracted with other things. Keeping in mind also that drowning does not just happen in pools, lakes, and in the ocean. It can occur for infants and little children in as little as a couple inches of water. So in the bathtub, in toilets, in buckets of water, in kiddie pools, all of these can lead to drowning incidents for children.
What signs or symptoms should someone look out for to avoid this type of drowning?
The things that parents should look out for is if there's a drowning incident after their child comes out of the water, they should be looking for things like excessive tiredness, excessive sleepiness, fatigue, even agitation or confusion. These can be all signs that the brain is not getting enough oxygen. In addition, there can be coughing, they can have trouble breathing, and they can complain of chest pain.
If a parent is worried that their child is taking in too much water, what should they do?
If they're concerned that the child is taking in too much water, the best thing to do is go to the emergency room. If they're uncomfortable monitoring their child for these signs that I already mentioned, then they really should get themselves evaluated. Some patients may be discharged after an evaluation. Some patients may be admitted for observation. And depending on the severity, the patient may actually need oxygen therapy or further ventilatory support.
Is there anything that can be done at home, or is an emergency room visit their best option?
The best thing to do is monitor for the signs that we talked about: confusion, trouble breathing, agitation, sleepiness, excessive tiredness, and chest pain and cough. If they note any of those, or they think those symptoms started and are getting worse, then they should definitely head into the emergency room.